Okay, so you know who we are. Next slide.
Yeah.
One other person is logged in.
Good. Okay, great. So we're just getting started here. I'm Claire Austin. I'm a senior science advisor at the Department of the Environment in Canada. And I need to make the statement that I am not speaking in the role of an official spokesperson, and I am not making explicit comments or recommendations on or explicit discussions about Canadian statutory, regulatory, or policy matters or data. I have no affiliation, financial or otherwise, with a pharmaceutical, medical device, or communications organization, and a conflict of interest. My PhD is health. And I'd like to take this opportunity to express my profound gratitude to the Government of Canada, the Department of the Environment, and especially to my manager, Lindsay Collins, for granting me the opportunity to devote my by limiting my work in the department to my most essential duties. I am also deeply indebted to my colleagues on the RDA work group and to the leadership of the RDA, Secretary, especially Secretary General Hilary Hannahall, without whom none of this work would have happened. Next slide.
Hello, I'm Rajni Agrawal, and I'm currently a postdoctoral researcher at the Leibniz Institute for Prevention Research and Epidemiology, which is shortly called as BIPS, and this is in the northern part of Germany. And I'm an epidemiologist by training, and I finished my PhD back in India in Tata Memorial Center. And shortly after that, I moved to Europe, and now I'm into various non-communicable diseases projects. But with COVID, I also kind of drifted my interest to adopt both non-communicable and communicable diseases. So here is the next slide.
The COVID-19 work group, we had 85 people sign up. Of those, 21 people were active in one way or another, contributing members. And in the writing phase, most of the writing was done by approximately 10 to 12.
Do you want to continue speaking on this slide, Claire?
Sure. So the way we're going to work this evening or tonight or today, we're going to describe to you how the work group functioned. Very briefly about the recommendations and guidelines and the spin-off activities since the recommendations and guidelines were published at the end of June. Talk about some of the lessons learned while doing this work. And then we're going to spend the bulk of our time, I hope, discussing the group discussion and next steps. So during the presentation, though, even if we were a bigger group, I would say the same thing, but especially that we're a small group, please do, and me or myself during the next slide, please. Oh, and sorry, and there, if you look in the chat, you'll find a link to the Google Doc where you can, if you scroll down to the very bottom while we're talking, you can type in questions or comments or thoughts that you may have. And when we're finished, this is where we will go for the document. Please type in your name.
Maybe Claire, try switching off your video because your voice is breaking in between.
Okay, go ahead, Rajni.
Okay, so here is just a brief description of how our work group functioned. So we were meeting very regularly, like three meetings per week, and this went on for 2 months. And we had sometimes additional meetings for the supporting outputs, and we still continue to sometimes have the meetings until the end of October. And the recommendations and guidelines are now part of the chapter 5 of the main RDA COVID-19 working group output. And there were 6 weekly drafts for public review, and the final version was out on the 30th of June 2020. So finally, we also had the final version on the 4th of November, which is a supporting output called Sharing COVID-19 Epidemiology Data. And it was on public review between the 31st of August and the 21st of September.
Well, the recommendations and guidelines were the mandate that we were given, and you'll find those in chapter 5 of the RDA COVID-19 overarching document. So there is no standard or coordinated system for collecting, documenting, disseminating COVID-19 data and related data and metadata. And yet disease epidemiology is critical to slowing infections, minimizing deaths, and making informed decisions. So despite our need for evidence-based policies and medical decision-making, there is no international standard or coordinated system. And this makes it very difficult to do some of the work we need to do. There are issues with interoperability, completeness, methodological heterogeneity, and data quality. And the audience for these data is very, very broad, as the audience for the recommendations and guidelines is broad. Not only government and international agencies and policy and decision makers, but epidemiologists, public health experts, of course, and disaster preparedness and response experts, funders, data providers, teachers, researchers, and especially with and other potential users. Next slide.
Okay, so here I would like to add that the epidemiology basically underpins the COVID-19 response strategies and public health measures. So, and recommendations support development of an internationally harmonized specification to enable rapid reporting and integration of epidemiology and related data across domains and between jurisdictions. So, and if I have to talk about guidelines, they outline a data-driven, coordinated global system that encompasses preparedness, early detection, and rapid response to newly emergent threats such as SARS-CoV-2 and the disease that it causes. So I would now like to go ahead and share the preprints and the supporting output we had. Claire probably would like to continue from here.
So this working group has been exceptionally hardworking and productive. As we already said, we submitted our primary output it was published on June 30th, but we have continued working since then and produced a series of preprints, 4 preprints, and 3 additional discussion papers, which you will find in the supporting output. And at some point when we're finished talking, we'll put the link in the chat where you can download all of them. Go ahead, next slide, please, Rajni.
Okay, so Just as Claire mentioned, some of the spin-off activities, of course, there were the preprints, the 4 preprints which are already there. And the next plan is to develop at least one of the peer-reviewed articles from one of those preprints. And we have already presented this work in the RDA New Regions of the Americas that we had last month on the 29th of October. Claire also presented the supporting output and the activities of the sub-working group in the Canadian Public Health Association conference on the 15th of October. And a very good development was also the funding. So in Germany, at least we could acquire the funding, something which is called as National Forschungsdata Initiative on the COVID-19 task force, where it is basically highlighting on the harmonization of COVID-19 data sets that are in Germany. So this is particularly for these COVID-19 studies that were conducted in Germany. And at the moment, we are now putting all the data sets together and annotating it. And finally, these would be on the website. And the other funding that is being now in the phase of acquiring is the follow-up on causal loops, focusing on food insecurity. And this is being developed by one of the very active working group members, Henry Tona.
Sorry, just to suggest, Claire, you might want to mute your audio when you're not speaking, because there is still interference when Rajni is speaking.
Okay, thank you.
Okay, now I give it to Claire.
So for
you want to talk about
internet for new collaborations, there are other collaborations that I'm aware of, but not in sufficient detail to be able to describe them. And the work group members are unfortunately not able to attend tonight to provide more detail. But there are collaborations in North America and in Africa. We're going to be talking fairly soon about a new work group that has spun off from the COVID-19 one. And in that case, we've developed a collaboration with CODATA, which is an organization under the umbrella of the International Science Council. Go ahead. Oh, so I should say, yeah, the work group is will be an RDA standard for surveillance data reporting for communicable diseases or infectious diseases. Next slide, please.
Okay, so just to have the reflections from what we learned and what we consider, what were the challenges and what we consider as success during the regular working group meetings. In my opinion, it was a very fast-paced working group, and like the other sub-working groups of COVID. But it is also good that it focused the effort and it made us maximize our outputs. Of course, the challenges that came along were we couldn't sustain for longer than that because people started dropping out, especially I see from the month of July. And of course, the good approach was the flat organization, the bottoms-up approach, which was very helpful for the rapid output and transparency. And finally, I must admit that we were a group of very dedicated and committed participants. So the volunteering community was very actively involved during the development of the working group output. And the only wish I would suggest is that we were looking for more experts, and we see that there were few gaps in the expertise. And for the new working group, we would like to particularly include a lot of expertise to develop the recommendations and guidelines. Would you like to add something to the slide, Claire?
So the one thing that we didn't write down here is that one of the lessons learned, you know, it's really not. I was surprised that we were able to sustain it for that rhythm of work, 3 meetings a week and 1.5 months. But then, you know, people do have to go back to their regular lives, or regular lives as they are these days. But it was frankly exhausting. So people really did get quite exhausted, I think, at the end of it. So for the new working group, first of all, it's not the same rhythm. It'll be over a period of 18 months, just the same. We're going to take the time at the beginning to really properly plan things out, define the objectives, exactly what it is that we're going to do, and implement some project management techniques. And I think that will that will be very, very, very helpful. Go ahead. So regarding the COVID-19 data themselves, the fact is that there is no single source of truth. Data quality issues are really quite similar to what we see in other domains also. The data are fragmented, they're difficult to find, they're difficult to assess, difficult to interoperate. And in the first preprint, where we review and analyze the data sources, we've looked at 32 selected publicly available COVID-19 surveillance data sets. The websites are commonly poorly designed. In many cases, it is necessary to spend literally hours digging around a single website to find and download all of the data and the related information needed to understand those data. We've also reviewed databases or catalogs of COVID-19 surveillance data, resources that provide a corpus of COVID-19 related text, resources that track COVID-19 government responses, RCO, potentially useful for analysis of COVID-19 data, COVID-19 related data analysis platforms, COVID-19 models, useful visualizations that go beyond the usual dashboards, commercial sites that showcase their product with COVID-19 as a use case, and other types of data that are useful and necessary for the analysis, interpretation of COVID-19 data. But all of these data are scattered. We wish that it was all available from a well-funded, internationally supported organization and platform. And we wish that it complied with even existing standards. But they sometimes do, sometimes don't. And as we said earlier, there is no common standard for this type of surveillance data. Next slide, please.
So here, as we go to the next steps, as Claire shortly introduced the new working group, which would be called as the Common Standard for Surveillance Data Reporting Working Group. And we have already prepared the charter, and it is now in public review. This was the working group charter was created sometime in August 2020, and the case statement is in public review until the 28th of November. So the plan here is to use COVID-19 as a use case and then expand it to generalize to other infectious diseases. So this will also help in preventing the next pandemics, if I may say, by facilitating early detection response. So Do you want to add anything here, Claire? Claire, you're on mute.
No, thanks, Rajni. I don't want to dwell any further on the new working group because we have an entire session this Wednesday to present this work and look at the case statement. And so if you are interested in that, and I hope you are, then I invite you to join us on Wednesday to take a more in-depth look at what we'll be doing for the development of a new common standard for surveillance data. And I think with that, we can close this presentation, Rajni, and everyone can go back to video perhaps, and in the chat, click on the link to go to the Google Doc where we'll continue working.
Yes.
Hello, can I? Hello.
Would you like to introduce yourself?
Yes, please. Sorry, I was a bit late on entering the room. My name is Maria Luisa Campos. I'm from the Federal University of Rio de Janeiro. We have currently a project linked to the Go Fair initiative. That's the Voda implementation network. We have a branch of it in Brazil. And we are currently evaluating some of the ontologies that have been put in place by the OBO consortium. So they have, in fact, what they've done is to have a whole hierarchy of ontologies, starting with the disease ontology. Then probably you probably know that, but what I would like to ask is that it's such a hard work whenever we talk about a common standard. What we see is another one coming up.
Another one comes along.
Yeah, so that's what happened with the ontologies for COVID-19, at least for the clinical cases and things. So that's what I wanted to ask you. What do we do with that if we bring about one more standard? What has I haven't been following. I've read the report, but not have been following the working group work. But I know it has been a very hard work. So congratulations for that. And that's a recurring question, I guess.
Right. So this is exactly what we're going to be talking about on Wednesday in the session for the new work group. But since you're really the only new person, and the other three, the rest, the three of us, we all know each other and very familiar with this work. So maybe we could answer your questions along those lines also. And you're quite right. You know, there are existing standards. You know, the WHO has standards, very well designed standards, not always followed, unfortunately, not always complied with, unfortunately. But also the WHO standards don't cover all of the situations that need to be. So we see, when we look at how the data are actually being reported, we see clearly gaps in the standards, and where those gaps exist, well, then people just they have no choice but to make up on their own how they're going to present the data, how they will name the variables, and so on and so forth. You know, within one country decides to do it this way, another country another way, and even within the same country. You know, within the same country, in provinces and states or even counties, they do it differently. And so, as you know, as epidemiologists, when we need to combine these data, huge headache. And so we're going to take a very practical approach to identifying what we need to focus on for the development of a new standard. If you get a chance at the first preprint.
Mhm.
Preprint number 1 in the chat.
Yeah, okay.
For your future reference, Maria.
Yeah.
But so from the analysis of what is actually out there, for example, University of Oxford or Johns Hopkins University databases and looking at newspapers also. So the New York Times or the Atlantic in the United States have done I would say a job of really divergent sources and collating it and putting it together. But we are in a very, very bad place if we have to rely on newspapers for our epidemiology data. And not that they're not doing a good job; they're doing as good a job as anyone can possibly do. They are journalists who have degrees in data science. They know what they're doing, but this for public health planning and for response, and certainly not for early detection. Right? So we're going to take to start off. So the new standard is for communicable disease. But we're going to use the COVID-19 as a use case to start, because that's what's going on now. We've taken a very in-depth look at it. We want to generalize that to applied so that it will not the next pandemic, but to prevent the next pandemic. Yeah. Because we'll have once we have a standard, and Mark is involved with some other people from 19.
Claire, maybe you want to try switching off your video so that
because it's
better. Yeah. Your voice is breaking in between.
Right. So they're looking at what can be done for developing fair data in a platform. So, and we had a meeting this last week in our new work. Had the most perfect standard that met everyone's needs. Everybody adopted this standard for reporting surveillance data. A broader system and platform. It also becomes difficult to implement. So we're not in this new work group that we're talking about here for common standard for reporting surveillance data. We're not going to go into the platform. I'm very happy that there's this other group that is interested in that, and we'll be working very closely together to coordinate those two efforts. But what you said earlier is quite right. You know, you get a standard, you get another standard, and you make your data compliant with the standards that exist, and oops, up pops another standard. And so, and this is a never-ending thing. And with COVID-19 now, this is certainly happening. So what do we do? I think that it is absolutely critical that we engage with international agencies, organizations, so supranational organizations. The WHO absolutely engage with these organizations and coordinate. There needs to be coordination and socialization of what it is that we're doing before we do it, so that we don't have duplication of effort, number one. And number two, that we attract the people who are interested in it and grow our expertise within this group so that we're all working toward a common goal. And as I said I tried to say during the presentation, it's also very, very important that we take the time, really take the time, beginning now and for the next few months to plan very, very carefully what it is that our objectives are and how we're going to work toward them. And again, coming back to your remark about, there are already standards, another standard pops up and you don't know where to put your head. This standard that we're envisaging would not be a total standalone. We will also take the time to identify all of those other standards out there that are related, and they would then be, if you like, a mandatory part of the standard. So to take a trivial example, in order to comply with this new standard that we're imagining, you're not in compliance with this new standard unless you are also in compliance with the ISO standard for representation of date and time, for example. And so within this new standard that we are envisaging, there would be a list of standards which are also required in order to be in compliance with this new standard. And of course, that would also include the WHO standard, for reporting clinical data, for example, in CRF, right? And so I'm hoping, I'm hoping that this will then resolve this very important issue that you've raised about the multiplicity and the multiplication of standards and people going off left, right, and center and doing the best they can because they don't have any choice.
Yeah. Thank you.
Maria, what was the one you mentioned? So are you talking about the Voda Network in Brazil?
Voda.
Yes. We have a branch with 2 hospitals, and we are using the ECRF form from the World Health Organization. And since the beginning, it has already 3 or 4 versions. I guess we are on the 3rd version now. But of course, at the data level, you can always accommodate that on versioning the form and then adapting your database and making it be version compliant. But of course, when it comes to metadata standards and to ontologies, that's a lot of effort because, well, at least on ontologies, what we've been trying to do, because we have worked with genomic data and with clinical data, and sometime it will have to get together. So the whole plan of Voda, in fact, is that in the end we have to be publication on all these areas, and they can talk with each other. But if we don't have a kind of process to build these ontologies, to make them talk with each other, like the OBO Foundation did, then it will be a hard work. So that's why I mentioned them. We don't work with BFO, we work with UFO. That's the, it's equivalent, it maps too, but it's the Nicola Guarino, started with him, actually with Dolce. But we are trying to use actually ontology patterns, this kind of best practice things that you can reuse, little modeling patterns that you can use in more than one ontology. And then it makes it easier for one to talk with each other. So,
right.
But it's a long way. I can see that there's no easy path to that.
Well, and it sounds like this will be the point of conversation in the session later in the week. as Claire suggested.
Yeah, I'll try to be there. I have a lot of classes this week, but I'll really try hard to be there. We're trying to synchronize things.
So Claire, for this session, I get the sense that you and Rajni were interested in what colleagues thought about next steps for what was essentially the COVID-19 epidemiology subgroup.
Yeah, but this is probably, unless Maria has an interest in going through that, I'm not sure that it's worth doing that right. It makes sense doing that right now.
Yeah, that's what I was going to ask you.
Yeah. So I can leave you now in the
Well, no, so the three of us won't do that either because. but if you like, I mean, I'm happy to about the a common standard.
I couldn't hear you very well. It was a bit.
So I changed microphones. That didn't help.
No, it actually helped immensely on getting rid of the interference, but it's I think the other challenge you're having is your bandwidth.
All right.
I think what I'm going to have to do, because I have to jump on another call shortly. So
yeah, we can meet some other time during the week. I'll sure try to get it. You said that it is on Wednesday, this new working group?
It's Wednesday. I think it's at the same time. Is it, Rajni?
Yes, it's at the same time.
Okay. So
poor Rajni has to stay up early.
Yeah, it's almost 10 o'clock here in Brazil in the evening.
But I think it's almost 2 o'clock for Rajni.
Rajni, can you put a link in the chat also for Maria? A link to the new work group case statement?
Yes, for sure. I'll just put it right here.
Or you do that, and then I'll find the link to the. So Rajni's going to give you the official link.
Okay.
And I'm going to give you another link, which is our next version that we're working on.
Okay.
Well, here is the link for the new working group, but the case statement is not in here. So probably Claire would.
Okay.
Claire, are you sharing the case
yeah,
statement?
The case statement. You're on you gave the web page. You scroll down there and it gives.
Okay.
Where we are. Currently in public review. The reason is that since the case statement went into public review, we've talked with CoData, and we will be rebranding the work group. So instead of an RDA work group, it will be an RDA/CoData work group, so I'm just editing the case statement to describe that more fully, and how this new common standard CoData decadal plan, which, Mark, by the way, this starts to get closer to the infectious disease platform that you were talking about this morning, which also would I would think be relevant to the CoData decadal plan.
Okay.
Yeah.
Okay.
I agree.
So, okay. Thank you very much then. So I hope to see you again this week.
Okay. Yeah, me too. Thank you.
Okay. Thank you. Thank you.
Bye-bye.
Bye-bye.
Thank you, Maria.
Bye-bye.